So this is the review for pharmacology. The first medication here, antihypertensive. Then we will talk about calcium channel blocker, beta adrenergic blockers, and vasodilators. Then alpha agonist, cardiac glycoside, super important for NCLEX board. You will not get your license if you do not know about the digoxin. And very important, every question we will get from this short note. And as I told you, all of the note already uploaded in the Google Classroom. Whatever it is, I will email you also. So then hemostatics medication, antibiotics, and then few note or point about antibiotics, because you are going to get your license, right? You have to know each and every important points. Iron preparation, laxatives, then steroid, anti-Parkinson medication, gastrointestinal medication, cholesterol lowering agents, antipyretics, and antihistamine, most common drugs we should buy over the counter, anticholinergics, anticonvulsant means psychiatric medication, then narcotics or analgesia. And then it is a complete package for pharmacology. Skeletal muscle relaxant, osteoporosis medication, and then go some review, short review, right? So, okay, so here, Desh, I got your text message, okay? Thank you so much for your text message. So now here we are going to show the short review first, and then we will go for all details. Let me go. So first of all, see the drugs classes and some of the example. Okay, my friend, every keyword is important for our board exam. As I told you, we are going to learn the most common medication. And as I told you, we are LPN, right? So our major job to deal with the patient about the medication. So you see the drugs classes and drugs name. Today, I will try to cover everything. If it is not possible, I will continue tomorrow as well. So first drugs here, it is called antiviral. So if you read the name, antiviral means the medication that used for viral disease or viral infection. Most common drugs we use, it is called oh, it's too big. Let me make it thinner. Okay, and make it green. Okay, so erase it. Okay, so antiviral medication like acyclovir or combivir. So all antiviral medication, if you read the drug's name, At the end of the drug's name, it is called VIR. Okay, VIR. What is to? Let me. Okay, it should be good here. Okay, so okay. Oh, let me fix it. Okay, so here antiviral, you see VIR. So always end of the word or medication name, like here, Combivir, Acyclovir. Okay, so easy way to remember, at the end of the drugs, it is VIR. VIR. Let me fix something first. Give me a few minutes. I'm going to fix something. Then you can easily get me. Okay, so it's wrong. Okay, so now I can share with you. Go here, go here. Okay, this one. So next, as I told you, antiviral means the medication that we use for the viral infection. Example here, Combivir. So when you read the name at the end of the word, it is VIR. You see antiviral. Second drugs like beta blocker. Beta blocker basically anti-hypertensive drugs. Most common example is metoprolol. So end of the word is, you see, OLOL, right? Metoprolol, etinolol. Other drugs is called SC inhibitors, like lisinopril. Drugs, what is the end with the statin? These lipid lowering agents, right? Let me go back in hypertensive medication list, that if you go in the top of the page, the first medication here, like this. Okay, let me see this one. Okay, some student is waiting. Let me add them first. Okay, so you see antihypertensive, the medication lower the blood pressure and increase the blood flow to the heart. Okay, so at least in this note, we will get few ideas about the most common medication that we use in hospital. Okay, and first one here I said, most common drugs we use antihypertensive are angiotensin converting enzyme inhibitor. Angiotensin converting enzyme inhibitor that treat hypertension and heart failure. Also protect your kidney function in the patient who have diabetic mellitus. Very important note, my friend. So there are so many anti-hypertensive medication, right? And also there are so many comorbidity. Comorbidity means one person more than one disease. Like a patient has a high blood pressure, also patient has a kidney problem, okay? Or a patient who have high blood pressure and also heart problem or also diabetics. So in that scenario, high blood pressure with diabetics, high blood pressure with kidney problem, in that scenario, angiotensin converting enzyme is best of choice. We call drug of choice. Okay. So again, I want to tell you there are so many medication, but which medication we supposed to use is depends on comorbidities. Means what are the patient other disease condition, or let me add some student they waiting. So okay, so okay, add it. So now, what are the drug list? Most common is called enalapril, lisinopril, ramipril, captopril, fosinopril, and also benzapril. So, if you ask me, do I need to know all of the drugs' name? Answer is yes. But how you make it easy? Like you see, every drug's ending is called pril. Enalapril, lisinopril, ramipril, captopril, fosinopril, or benzapril, and is pril. If you ask me, do I need to know the drug's trade name? Answer is no. Every drug has a two names. One is called generic name, other is called trade name. Okay. Generic name is always same, but the trade name is varies. Means it depends on different companies, because there's so many companies in the market. They bring so many drugs, but the generic name is always same. It is important to know. So you see, NCLEX board asks the question: if doctor give the enalapril, lisinopril, what are the common side effects? If I see, I have to inform to the doctor, right? Notification to the doctor. So most common side effect, patient has a cough, it is called dry cough, and anaphylaxia. So in this picture, you can see this patient, it is drug reaction, anaphylactic reaction. In this patient, this three group picture, we can see the lips is swelling. Okay. This is the question NCLEX would ask. So cough, anaphylaxis, palpitations, taste change, orthostatic hypotension. So the medication we use to reduce the blood pressure, but side effect is causes hypotension. It's called ortho, means when patient change the posture, patient blood pressure go down. And other things is most common and most important. Potassium level get increase. Potassium increases. Hyperkalemia develop. So if I have a blood pressure and you prescription me lisinopril, we have to check my blood potassium level, because potassium level go up. Renal impairment, impotency, you see. So impotency and also leukocytosis develop. Leukocytosis. Give me a few minutes. Okay, so leukocytosis means WBC number is increasing. Okay. And like a patient is 25 years old, right? And patient is newly married. It is good not to give them this medication because chance to develop impotency, right? So the common side effect, nausea, vomiting, dry mouth, headache, and dizziness. The most dangerous side effect of these groups of drugs is called Steven-Johnson syndrome. Steven-Johnson syndrome, I said, right? So what is nursing implementation? You say it is called nursing note. We need to monitor the blood pressure. We need to monitor BUN, means blood urea nitrogen, and creatinine. Also electrolyte and WBC count, right? Now you see another question for NCLEX board. Contraindication in pregnancies, right? So important. So if a patient, female patient, Zoom user enter the waiting room. Okay. If a patient has a pregnancy, we never ever give angiotensin um, inhibitor medication like benzapril or lisinopril. Why? What are the reasons we do not give? The reason being, it is teratogenic effect to the baby. Not only this group. So some book wrote SC inhibitor and angiotensin receptor blocker, both classes associated with injury to the death of the fetus and making them contraindication for pregnancies. Okay, this is the question NCLEX would ask. Very important. And also, it is we need to avoid NSAID. Give me a few minutes because student may be trying to get me. So, okay. Uh, uh, Give me a few minutes, my friend. We here exit. Okay, Miss, please talk to Miss Maggie. Hello. Yeah, are you at school right now? Okay, so can you talk to Mr. Mimi or Miss Maggie or Mr. Mimi is also okay. Yes. Okay. No problem. Oh, Sorry, I was talking to school because few students come from two students wedding. Okay, so what I said, my friend, potassium retention is the most common side effect. Okay, next group of drugs is diuretics. So diuretics, because of some unknown reason, NCLEX board ask the question from here. They like it because of some reason I said. So diuretics here excrete the sodium and fluid and reduce the blood pressure. So diuretics basically we use for emergency cases. Like suddenly a patient blood pressures go up, okay? We need to reduce the blood pressure within a short time. We use the diuretics, okay? Diuretics, if you read the name, you can get some ideas. Means it increase the P. Too much fluid get out from the body and blood pressure go down. Okay, so diuretics again classified to the loop diuretics. Uh, Good morning. Yes, good morning. How are you?
Good morning.
Okay, so now loop diuretics like potassium depletion. So you see that the loop diuretics, the diuretics that work in the loop of Henle. Loop of Henle is a part of the nephron. Nephron is the inside the kidney. So most common example is bumetanide, furosemide, torsemide. Okay, so what are the common? Sometimes NCLEX board simply asks which one is a loop diuretics. You have to know bumetanide, furosemide, torsemide. All of them are loop diuretics. And loop diuretics can cause potassium depleting. Depleting means reduce, go down. But SC inhibitor increase the potassium level. Both are bad for your heart. Both can cause arrhythmia, and arrhythmia lead to heart failure. Okay, I want to tell you something more about this. Loop diuretics that NCLEX board asks. NCLEX board asks, I said, most effective. The loop diuretics are most effective and fast acting medication. And loop diuretics we can give orally or IV route. So if patient took the loop diuretics, we always watch for electrolyte level because they decrease the potassium level or may causes ototoxicity. This is the question NCLEX board asks. Ototoxicity. So sometime you see some patient come to clinic, outpatient clinic, with the leg swelling. Leg swelling, it means they have a edema. If patient has a acute edema, even pulmonary edema, we use loop diuretics. Most common loop diuretics are furosemide and bumetanide. So let me give me a few minutes again. Hello? Yes, please. Okay, so another medication here, uh, it is thiazide diuretics. Thiazide. It is also potassium depleting. Hmm? But you see, last group, it is potassium sparing. Okay, it is very important for NCLEX board. So I am telling potassium depleting, potassium sparing. Sparing means reabsorption. Let me tell you, thiazide diuretics. Most common example are hydralazine or hydrochlorothiazide or chlorothiazide. So easy way to remember. You say hydrochlorothiazide. At the end, it's thiazide. This is thiazide. If you remove hydro, then chlorothiazide, this is chlorothiazide. Again, when you get in NCLEX board, thiazide, example is hydrochlorothiazide or chlorothiazide. You usually NCLEX board repeats same question again and again. Okay. So the most common side effect, they can cause hypotension, hypokalemia, hyponatremia. So potassium go down, sodium go down, blood pressure go down. And also thiazide can cause photosensitivities and hyperglycemia. So my friend, like I am your patient and you are the RN or LPN today, and I told you I have a diabetes, and you know doctor gave thiazide. So what you educate me? You educate me that you have already diabetics and you also taking thiazide. You have to check your blood sugar level because thiazide increase the blood sugar and it is can cause hyperglycemia. Okay, so let me recap a little bit. As I told you, thiazide, most common use hydrochlorothiazide, and they act basically distal tube and used for chronic hypertension. So if anybody has a chronic high blood pressure, we use the thiazide. Or if anybody slow acting diuretics, we use thiazide diuretics. So thiazide diuretics increase the toxicity in the heart. Medication like quinidine or digoxin also. So if patient has to take digoxin, you have to monitor very carefully if they should take thiazide as well. Okay. So nursing in implementation. So as what is the nursing note? If my patient took thiazide diuretics, need to monitor blood urea nitrogen, potassium, and glucose level. Monitor intake and output chart and increase the potassium in the diet. So we give less potassium to the patient. Less potassium to the patient. Again, the last groups of drugs here, it is called potassium sparing diuretics. So let me tell you something more, otherwise students get confused. Dr. Joe supposed to take the class today. Unfortunately, he is not able to take class this week. So I'm taking his class. My name is Dr. B. And I have a plan to continue pharmacology today and tomorrow, just a short review so that you can get some ideas. This note you will able to get in our Google Classroom, okay? And I will send you the class recording after my class, okay? Again, pharmacology is super important for our NCLEX board exam. Without pharmacology, I believe it is very difficult to pass the NCLEX board. Pharmacology is one of the hardest subjects, but what I want to request you, you do not need to memorize, but you have to redo or recap it again and again. So if you review the short note just for 5 days or 1 week, same thing you read, only 1 week, I believe it will be printed in your brain and you will answer. Trust me. Potassium sparing, most common example are spironolactone and triamiterone. So sometimes NCLEX LPN board asks question, which one is a water pill? Water pill, again I said. And this is spironolactone or triamiterone. Okay. So most common again, potassium sparing means the retention the potassium. So if the retention the potassium, patient chance to develop hyperkalemia. But thiazide diuretics or loop diuretics just opposite. They can cause hypokalemia, but spironolactone can cause hyperkalemia. If you compare and contrast, it would be easy to memorize. Another problem is constipation, menstrual irregularities in case of female, muscle cramping, dizziness, and headache. What is nursing implications? We need to monitor electrolyte and decrease the potassium in the diet, right? Let me recap it a little bit, then I go next drugs. Potassium sparing diuretics, usually we give orally, and it is not as powerful like loop diuretics or thiazide diuretics. Means if patient need immediate reduce the blood pressure, we choose loop diuretics or thiazide diuretics, right? But potassium sparing diuretics reduce the blood pressure slowly or gradually. So if we give the potassium sparing, we need to monitor potassium level and do not give the patient with a diabetes mellitus. It is important for NCLEX board. And also, we do not give potassium sparing diuretics if patient has heart problem or if patient need to take digoxin. And oh my God, what's wrong? Okay, sorry, my friend, because some of the student came from the different states. Sometimes they calling me because they do not know today I have a lecture. Okay, so let me talk the second group of drugs. It is called calcium channel blocker. Very important for our NCLEX board. Calcium channel blocker, if you read the name, means these drugs can work in the calcium channel and they block the calcium channel. Okay, so treatment for angina and hypertension. So if any patient has a high blood pressure and also angina or myocardial infarction, we can give them calcium channel blocker. So generic drugs name verapamil, nifedipine, diltiazem, felodipine, and amlodipine. So if you read the name at the end of the medication, most of them are PINE, pine. Okay. So example, most common example, amlodipine or felodipine, nifedipine. Okay. How they works in these groups of medication, how they work, I said. They block the calcium channel from crossing into the heart muscle cell, and they decrease the blood pressure, they decrease the pulse rate, but increase the contractilities. Okay, so common side effect: hypotension, headache, peripheral edema. So you see, this is the feet in the picture. It is swelling legs, and this is when the healthcare provider examine, put the pressure over there. It is depression occur. Look like it called patient has a severe edema. It is called peripheral edema because of calcium channel blocker. It can cause GI upset, flushing. You see in this picture, it is facial flushing, and also syncope. So here's something, how I remember the name of calcium channel blocker. Easy way to remember, I have a very nice doll. I have a very nice doll. Okay, means nice doll. A for amlodipine, B for verapamil, N for nifedipine, and D for diltiazem. So if you remember, I have a very nice doll. A for amlodipine, B for verapamil, N for nifedipine, and D for diltiazem. All of them calcium channel blocker. So what is the nursing implication or nursing note? We should educate the patient if they need to take calcium channel blocker, and if this can see peripheral edema, report to the doctor. If can see ankle edema, avoid the operating machineries and avoid the grapefruit juice. So this is the grapefruits. Okay, so calcium channel blocker and these fruits not together. Okay, so what are the note or what we learn from here? We learn the name of the calcium channel blocker, side effect, and some note that we should hold if patient heart rate less than 60. We will not give calcium channel blocker. Also, It is good to avoid the grapefruit juice, avoid the operating heavy machineries. What next? Next here, everybody know it is beta blocker, beta adrenergic blocker, and is OLOL drugs. Management of hypertension, angina pectoris, congestive heart failure, and MI means myocardial prevention. So it is very easy to memorize the generic drugs name: atenolol, propanolol, nadolol, metoprolol, and carbidiol. So the drugs name end in OLOL, right? And most common example are metoprolol, atenolol, or carbidiol. How these drugs works? The action blocks the epinephrine and norepinephrine from binding to the beta receptor on the nerves. So these drugs work on the beta receptor and they blocks it. The most common effect of beta blocker, they decrease the blood pressure, they decrease the pulse, they decrease the force of contraction, but increase the contractilities. So next, what are the common side effects? Hypotension, bradycardia, dizziness, impotency. So a young man or female, reproductive age is not too good, give them beta blocker. So you kill their sexual life. Diarrhea and nausea, hyperglycemia, increase the chance of congestive heart failure, increase the chance of PVD, peripheral vascular diseases, and increase the bronchospasm. So some note here. Beta blocker, how works? They block the epinephrine and norepinephrine from brings to the beta receptor of the nerves. The effect of beta blocker: decrease blood pressure, decrease pulse rate, and decrease the force of contraction, but increase the contractilities. And last note here, beta blocker only will treat the glaucoma, and this is called timolol. Timolol is the medication of choice for glaucoma, important for NCLEX board. What are the other note for beta blocker? Check the pulse before administration, monitor the blood glucose in diabetic patient. So if patient has a history of diabetes and patient need to take beta blocker, we have to tell they need to adjust insulin or metformin, because beta blocker can cause hyperglycemia. Also administer with the food. Taper dose to discontinue. So if need to stop the medication, it is good to tapering. Means 1 week 10 milligram, second week 5 milligram, last week 2.5 milligram. Also some contraindication. Like if patient has a asthma, good not to give beta blocker, because beta blocker can cause bronchospasm, heart block, cardiac failure, diabetes mellitus, hypoglycemic shock, and also extremities, occlusive arteries. How we remember? It is easy to remember A, B, C, D, E. A means asthma. If patient have asthma, no beta blocker. B stand for heart block. If patient has a second degree or third degree heart block, good not to give beta blocker. Cardiac failure. C for cardiac failure and D for diabetes means hypoglycemic shock. And E stand for extremities means occlusive artery like peripheral vascular disease, Bart's disease. It's good not to give. And other things is sometimes NCLEX board asks what are the medical condition is contraindicated again. So hold if the heart rate less than 60. Again, I want to recap it. Calcium channel blocker or beta blocker, we will not give if patient heart rate less than 60, 60. Okay. Next, here, another groups of drugs, most common we use, it is vasodilators. So vasodilators basically relax the smooth muscle in the blood vessels. The generic drug's name, hydralazine, nitroprusside, nitroglycerin, isosorbide mononitrate, isosorbide dinitrate. So easy way to remember, isosorbide dinitrate, isosorbide mononitrate. Di means two, mono means one. And nitroglycerin, nitroprusside, easy. There are invisible similarities. The most common side effect, they can cause palpitation, tachycardia, hypotension, dizziness, headache, diaphoresis, syncope, and weakness. So nursing implications, this is showing one picture, nitroglycerin. So take with food or the nitroglycerin protect from the light. It is good to protect from light. Also continue to monitor EKG, electrocardiogram, and blood pressure monitoring. Nitrostate for sublingually use. So if you give nitroprusside, educate your patient to use sublingually, means behind the tongue, and do not swallow when they need to take it. Good. Like the question from this medication. The vasodilator, particularly nitroprusside or nitroglycerin, the action, they have a systemic effect and they have an effect on coronary artery and they vasodilate. When anything is vasodilate, blood pressure go down. Vasodilator basically we use for angina, we use for high blood pressure, or we use for chronic heart failure. So NCLEX board asks question, if nitroglycerin is given sublingually for angina pain and it is not, if the pain is not relieved, what should we do? We give additional tablet in 5 minutes And you can give up the 3 tablets over 15 minutes. And also, when you give the last dose, call 911. Okay. So, what are the most common side effects of nitroglycerin? They can cause headache. And other common side effect I told here: hypotension, palpitation, tachycardia, and syncope. Okay. So you see in the corner, one of the medication is called Viagra, right? So Viagra and nitroglycerin or nitroglycerin or Basodilator never ever together. It is very important for NCLEX board. So we never give those two medication together. It can cause cardiac shock. So again, I want to tell you, if NCLEX board asks like a question, if your patient like a man and taking Viagra like sildenafil, what should you tell them? You tell them do not take with nitroglycerin or Basodilator and Viagra together. Okay. And sometimes Basodilator or nitroglycerin IV route we use. If IV nitroglycerin and IV dysethmic should be placed on infusion pump. Infusion pump we have to use. Okay. So next drugs we go. This drugs is called alpha agonist. So alpha agonist decrease the effect of dopamine on blood pressure. The drugs name clonidine and methyl dopa. These drugs can cause potassium hypotension, postural hypotension, impotency, and also dry mouth and drowsiness. Alpha 2 receptor blocker, most common losartan or valsartan. Alpha 2 receptor blocker can cause the hypotension or hyperkalemia, angioedema or dry cough, and also renal dysfunction, right? So nursing implementation again, monitor the blood urea nitrogen and also electrolyte, particularly the potassium level. And also is electrolyte level. Another drug is called alpha 1 receptor blocker. This alpha 1 receptor blocker we can use reduce the high blood pressure. Also, we can use if patient have benign enlargement of prostate. Most common drugs use doxazosin, prazosin, terazosin, and temlolosin. You have to know the drug's name because sometimes NCLEX board simply asks what medication, which medication is the group of alpha 1 receptor blocker, or which medication we use for benign enlargement of prostate. You maybe ask me, I'm not doctor, why I need this question? Because NCLEX board sometimes asks, a patient came with benign enlargement of prostate. What you anticipate physician can prescribe? You see the question type, what you anticipate. And you say prazosin. So when doctor give prazosin and doctor not in hospital or rehab center, you are the person who always stand by with the patient. So after the prazosin, if patient have palpitation or blur of vision, and if you do not know, blur of vision or palpitation is a side effect of prazosin, how you notify to the doctor? This is the reason you have to know. The most common side effect, hypotension, palpitations, blur of vision, nausea, diarrhea, dizziness, light headache, edema, and dry mouth. Nursing implications, administer the dose at bedtime, monitor blood pressure, assess for edema, and also teach avoid operating machineries. Other most important drugs for our licensing board exam, it is cardiac glycoside. Cardiac glycoside we use to treat atrial fibrillations or atrial flutter and chronic heart failure. Generic drugs name like Digoxin and Digoxin is a generic name. Common side effect like fatigue, anorexia, headache, bradycardia, nausea, vomiting, and diarrhea. So cardiac glycoside, particularly digoxin, how they work. How this medication work? So some books said nobody really know how digoxin works, or however there are so many theory basically, or clinical trial proved digoxin is a medication that save your heart, right? The most common effect, they slow down the heart rate and increase the blood pressure, and also tissue perfusion increase. There are some note. Digoxin has a very narrow therapeutic index. Therapeutic level is 1 to 2. If the greater than 2, patient present with digoxin toxicity. If it is less than 1, digoxin will not work. So you have to check always drug level. So NCLEX board asks question, what are the signs, symptoms of digoxin toxicity? In case of GI, we can see anorexia, nausea, vomiting, and diarrhea. In case of CNS, headache, central nervous system, fatigue, and lethargy. Cardiovascular, bradycardia, dysthymia. So if patient need to take digoxin and after medication inject, we found patient has a dysthymia, means patient has a digoxin toxicity. Some ophthalmological symptom means eye problem. Flash of light, most common. So toxicity may be treated with gastric lavage or activated charcoal or digoxin fab fragment. So this is the antidote of digoxin toxicity, sometimes called dizzy band. or dizibind, digoxin fab fragment, which is antidote. So what are the nursing implementation? So we monitor apical pulse for 1 full minute. This is the NCLEX products. 1 full minute we need to count down the apical pulses. Do not give digoxin if the pulse rate less than 60 in case of adult, less than 90 in case of child, or less than 70 in older child. So before give this medication, as a nurse, we have to check the pulse rate, right? So now some NCLEX tips. Patient must monitor potassium level. Low potassium level can increase the risk of digoxin toxicity. What note? NCLEX note again. What are the antidote we use for digoxin toxicity? Activated charcoal or digoxin immune fab or dizibind. So what we need to monitor? We need to monitor hypokalemia, hypomagnesemia, but hypercalcemia. So digoxin glycoside can chance to reduce the potassium level and magnesium level and increase the calcium level, right? So there are few more information I want to share or I want to recap with you. So if patient need to take digoxin, always take apical pulse and hold if the heart rate is less than 60 in case of adult and less than 100 in case of infant, or less than 90 in case of child. The digoxin level I showed you a few minutes ago, the therapeutic range is 1 to 2. If greater than 2, the client is digoxin toxic. And the sign of digoxin toxicity, I'm recapping because it is super important for our NCLEX board. The client will see yellow spot or vomiting and abdominal pain, and warning sign of toxicity in case of infant and children is bradycardia. Patient must monitor potassium level, and low potassium level can increase the risk of digoxin level. It is here. And patient is toxic and give the activated charcoal or digoxin immune fab or dizibind. And here we can see after digoxin toxicity, if you take the EKG, electrocardiogram, this is the normal electrocardiogram, the positive P wave, negative Q deflection, and QRS complex, then positive T wave, right? And here the PR interval, PT interval, and QRS intervals. But I said this is the normal. But if patient take digoxin and patient develop digoxin toxicity, that times we will see ST segment depressed is a typical of digoxin toxicity. Here, while you see this is the S and this is the T, and this is not depressed, okay, and also T is deflex, inflex, but here we're showing the depression. If you compare with this, you can get it easily. So the curved ST segment, or we can say ST segment is depressed, depression, not inflects, deflects is a typical sign of digoxin toxicity. So what are the action we should do? So increase the force of heart contraction, which can benefit for the heart failure for irregular heartbeat if the patient with this, right? And what next? Next here, so hemostasis used to control the bleeding when blood clots are broken down too quickly, and also prescribed for acute life-threatening hemorrhages due to the hyperfibrinolysis. The most common drugs we use, like aminocaproic acid, common side effects are nausea, vomiting, diarrhea, and also cardiomyopathy. The nursing implementation we taken once an hour for about 8 hours or until the bleeding is controlled, right? The next groups of drugs we are going to talk about, the for the NCLEX board, it is antibiotics. Okay, so let me show you what groups basically we are going to talk. Antibiotics: penicillin, cephalosporin, then aminoglycoside, tetracycline, antitubercular drugs, fluoroquinolone, antibacterials, and macrolide. I'm going to explain one by one, and it is important for our NCLEX board. Here we are going to talk about antibiotics. Antibiotics we use to treat the infections, right? The first category, penicillin. Penicillin, most common drugs, penicillin, amoxicillin, and ampicillin. Let me recap it: penicillin, amoxicillin, and ampicillin. This is the most common example. Penicillin, basically we use, or how they help us. Penicillin we use for gonorrhea or pneumonia, and even we use for urinary tract infection. The common side effect of penicillin, they can cause nausea, vomiting, diarrhea, and super infections. Like a patient came to you for pneumonia or UTI, you give them strong penicillin. Because of strong penicillin, the the good bacteria also die, and then fungi infection. Fungus can cause infection and is called candidiasis. So it is called super infection. So if any patient need the penicillin, we always ask about the any kind of history of penicillin. So first ask about the history of penicillin allergy, any kind of. Also, we have to ask about any kind of reaction such as itching or any kind of rash or hives. Penicillin do not give if any reaction has occurred in the past. So if patient said, I had a reaction because of penicillin in when I was 5 years old, means patient has a history of penicillin allergy. But good things, penicillin is a safe for pregnancy. So during the pregnancy, penicillin is a safer drugs. Okay. So another point is the person who take the penicillin the first time in life as a LPN or RN, we have to stay with the patient just like the blood transfusion. We have to stay and check any kind of allergic reaction. If any allergic reaction, we give the antidote. What are the name of antidote? It is epinephrine. Antidote is epinephrine, right? Also, we have to educate the patient to who take the penicillin. So educate patient to take the medication for full prescription length of the time. And also do not stop when symptoms disappear. What does it mean? Sometimes we take the antibiotics after 1 or 2 days, patient feel good and they stop the medication. It is not good. If you need to take 7 days, you have to complete the total package or course. Otherwise, antibiotics will be resisted in your body. What next? Next drugs here, cephalosporin. The most common example, cephalexin, ceftriaxone, cefofuroxirine, cefadozin, and ceftazidime. NCLEX board, most common example, they like cefazolin, cephalexin, and ceftriaxone. Cephalosporin, how it helps or how they work or when we use it. So if any patient has a gram-negative bacteria infection, we use cephalosporin. If any patient has UTI or urinary tract infection, we can give them cephalosporin. If any patient has pneumonia, gonorrhea, we give them cephalosporin. So if any patient has a allergy to cephalosporin, we will not give cephalosporin. But I want to tell you, if any patient has an allergy to penicillin, we will not give cephalosporin as well. Let me recap it. Do not give it if patient has a known allergy to penicillin. The most common side effect of cephalosporin, they can cause diarrhea, furry tongue, anemia, and increase liver function test. So side effect, we should remember cephalosporin, okay? We should remember for the NCLEX board. And some books said cephalosporin increase high blood sugar level, so hyperglycemia, or they can cause anaphylactic shock if patient has a history of cephalosporin allergy or penicillin allergy. Also, cephalosporin can cause insufficient platelet, we call thrombocytopenia. Platelet number go down, or patients sometimes develop kidney toxicity, means toxic effect, or patient come with yellow lobe or diarrhea. So if patient have cephalosporin toxicity, we have to have antidote. We use epinephrine. The next groups of drugs is aminoglycoside, shortly called mycin. Aminoglycoside, example, tobramycin, amikacin, neomycin, gentamicin, streptomycin, right? Most commonly used, I said, streptomycin or gentamicin. Other two drugs we use vancomycin and erythromycin is also aminoglycoside. Aminoglycoside very powerful antibiotics to treat the condition like meningitis or infective endocarditis, septicemia, and Clostridium deficit infections. But they have some side effect. Aminoglycoside can cause ototoxicity, neurotoxicity, and nephrotoxicity. So I said ototoxicity means patient has a cause of ER problem or kidney problem, nephrotoxicity also, right? Or kidney cell damage, ear cell damage, or brain cell damage, neurotoxicity. The effect on hearing impairment, patient, but you know how patient tell it. Patient will not say, I have a toxicity, right? Patient will tell you, I have ringing in my ear or dizziness. Hmm? But it is important to know if your patient are pregnant, do not give during the pregnancy as tetracycline. Tetracycline also contraindicated during pregnancies, right? So if patient need aminoglycoside, it is important to draw the peak and dot level. Blood test is important. And also I said, um, if patient has any aminoglycoside toxicity, give the antidote, and antidote name is calcium gluconate. What next? Next group of drugs is tetracycline. Tetracycline, the drug's name, tetracycline itself, and doxycycline. Okay, and some books say minocycline. So what are the indication of tetracycline? If patient has urinary tract infection, pneumonia, gonorrhea, syphilis, right? We give tetracycline. So like a patient has a history of penicillin allergy, we give them tetracycline, right? So tetracycline has some side effect like photosensitivities and also tinnitus. NCLEX board sometimes asks which antibiotics can cause photosensitivity or phototoxicity, nephrotoxicity, or hepatotoxicity. It is tetracycline. Also keep out the direct sunlight if patient has a photosensitivity. Also need to monitor the liver enzyme because tetracycline has an effect of hepatotoxicity. Also need to monitor the kidney function. Why? Because tetracycline has a chance of nephrotoxicity, right? So again, as like aminoglycoside, tetracycline do not give if pregnant mother or nursing mother. Also do not give with the cow milk. I'm taking the important note for NCLEX board exam. And tetracycline do not give to the children under the 8 years old, right? And also because will cause the danger permanent discoloration or turn to black. Also, tetracycline give with medication with a straw. So if patient need tetracycline, particularly the children, then it is good to tell them medication with a straw and avoid giving with Lasix. Important for board exam. Next medication we use, it is called anti-tubercular agents. Isoniazid, rifampin, ethabutyls, and also some books say streptomycin as the effect of anti-tubercular effect. When we give anti-TB drugs or anti-tubercular drugs, we need to check peripheral neuropathy. If patient develop peripheral neuropathy, we need to check patient take vitamin B6 or pyridoxine. Hepatotoxicity, discolor the urine, and also even discolor the contact lens. Visual disturbance and precipitate of gout. So if anybody has a gout, increase the acute exacerbation of gout because of anti-tubercular agents. Next groups of drugs here are fluoroquinolone. Fluoroquinolone, basically example are ciprofloxacin, moxifloxacin, levofloxacin, and ofloxacin, right? Out of all, most common are ciprofloxacin. So how they help? If any patient has a bacterial infection, we give ciprofloxacin, or respiratory tract or respiratory anthrax infection or urinary tract infection, we chose fluoroquinolone, particularly ciprofloxacin. So fluoroquinolone or ciprofloxacin has a photosensitivity effect, like tetracycline has a photosensitivity effect. So Cipro can cause GI distress like nausea, vomiting, and diarrhea, right? And also ciprofloxacin with this medication has a chance of false positive on urine drug scan will show for opioid. In case of children, there is a concern these drugs may cause the arthrotoxicity. Let me read it. The common side effect: tendonitis and tendon rupture. This is the question NCLEX would like. Which medication chance to develop tendon rupture or tendonitis? It is ciprofloxacin or fluoroquinolone. GI upset, I said nausea, vomiting, diarrhea, rash, increase the liver function test, headache, photosensitivity, increase the effect and avoid with a theophylline or coumadin, caffeine, steroid, diuretics, and cardiac medication, particularly quinidine, amiodarone. So, which drugs you have to avoid with ciprofloxacin? Because increase the effect of drugs. Theophylline. Theophylline we use particularly for bronchial asthma. Coumadin, blood thinner. Caffeine, steroid, diuretics. And some medication can decrease the effect, like antacid. So antacid and fluoroquine not together. Multivitamin and iron with cipro, never ever. What next? Next medication here are antibacterial like metronidazole. Metronidazole we use for GI infection, GIT. Other name is trade name is called Fragile. So common side effect: dark and red-brown urine, metallic taste, candidiasis infection, peripheral neuropathy, increase the effect of coumadin. So it is good to avoid metronidazole and coumadin together. Other antibacterials like macrobid, nitrofurantoin, or macrodentin. So this macrobid or nitrofurantoin we use for urinary tract infection. And sulfifoxazole basically we use for pediatrics suspension, treatment for acute and recurrent or chronic UTI. So common note, if patient have chronic pulmonary reactions, GI upset, or C means Clostridium deficit, or dizziness, pruritus, fever, jaundice, angioedema, Stevens-Johnson syndrome. Sometimes this is the side effect of these groups of drugs, but not always. The last groups of drugs here, it is called macrolides, like erythromycin, clarithromycin, erythromycin, and clindamycin. All of this together is called macrolide. So these groups of drugs can cause nausea, vomiting, diarrhea, thrombocytopenia, abdominal pain, chest changes, upper infection, respiratory infections, super infection, right? Sorry, super infection means when you give the macrolide and good bacteria also die, and other infection is common like candida. Another major side effect, Stevens-Johnson syndrome. What next? This is the picture. We can see very bad infection, Stevens-Johnson syndrome, because of antibiotics of macrolide. Here we are going to learn some common information, or let me read some of this. This is nursing implementation for antibiotics. Every student have to know. You must know before you go to the exam. Patient should be instructed to complete the full course of therapy. So if anybody need to take antibiotics, we educate them, you have to take full course. Like you take today, tomorrow you feel good, then stop, never do it. Avoid the cephalosporin in the client allergic to penicillin. Cephalosporin means cefazodine or ceftriaxone, right? In the client who is allergic to penicillin, like amoxicillin, ampicillin. And in that case, we give them mycin, right? Like I said, vancomycin, streptomycin, erythromycin, or tetracycline, doxycycline, minocycline, or macrolide we give. Cephalosporin increase the risk of Clostridium deficit infection and give 1 or 2 hours before food, lunch or dinner before 1 or 2 hours. Cephalosporin. Mycin drugs means vancomycin, streptomycin, erythromycin, gentamicin. If patient need, we need to monitor kidney function like blood urea nitrogen and creatinine. And do not give tetracycline to the pregnant woman or child under the age of 8 because strain the denture or teeth. So tetracycline we never give if mother are pregnant. But in that case, we can give them penicillin. Penicillin is safe for pregnancy. Also take on empty stomach, means 2 to 3 hours after food. Do not take with antacid or with milk or yogurt. Tetracycline never give with antacid, milk or yogurt. Take doxycycline with a full glass of water and remain upright for 30 minutes. So if your patient take doxycycline or minocycline, take orally Cipro or ciprofloxacin either 2 hours before or 6 hours after taking antacid. So antacid and ciprofloxacin is good not to give together. Same as multivitamins and ciprofloxacin not together, or iron preparation do not take with milk or yogurt. Take macrobate with food to improve absorption and prevent GI side effect. Anti-TB like isoniazid. Give isoniazid with the vitamin B6 to prevent peripheral neuropathy. So if any patient need to Jobex, monitor complete blood count and avoid the food containing the tyramine. TB medication or anti-tubercular medications may be given to combination to prevent resistance. Also, avoid ethyl alcohol with metronidazole or Frazil. In this picture, we can see this is called tendoachillas or tendon. Tendon sometimes rupture because of medication side effect, particularly tetracycline. Okay. So we are going next